Obesity is a lifelong disease that takes years off of patients' lives, and it's because the effects of obesity cause diseases to get worse. As people gain weight, health issues become more of an issue, such as hypertension, diabetes, sleep apnea, and joint problems that can lead to need for a total hip or a total knee replacement. As these problems get worse, the ability of the patient to work becomes less. They have more time that they're missed from work, and they're unable to maintain their work habits. They're less productive, and in some instances, even become disabled. It also impacts the children because adolescent obesity has become a tremendous problem in the United States. Kids are getting bigger, and it has a big role in terms of genetics and our environment. The food we eat is no longer as healthy as it was before. There's a lot of processed foods out there, a lot of McDonald's and quick fast food out there, and none of it is nutritionally good for us. As a result, our kids are getting bigger than we are. For the first time in our lives, our kids may not outlive us because of obesity. We have children who go to school who weigh 200 pounds, 300 pounds, and are ridiculed. They don't want to go to school, and they get depressed, and it leads to a lot of family issues. Well, the first thing in treating obesity is to recognize it as a problem within the family unit and to get help. Start with a primary care physician and try diet and exercise, which is the mainstay of trying to lose weight. Well, once you get to a certain weight, a BMI over 35 with health issues or a BMI over 40, weight loss programs such as diet and exercise really don't work well. That's where surgery comes into play. Surgery is an effective tool to allow a patient to lose weight, but not just lose the weight, maintain that weight, and have a durable tool to help keep that weight off. So that's where surgery comes into play. And the great part about being in surgery right now is there's a wide armamentarium of procedures we can do to help patients lose weight. There's the intragastric balloon, there's the lap band, there's a sleeve gastrectomy, and the gastric bypass. Each of these helps the patient feel full so that when they go to eat, they eat less, they absorb less food in some cases, and lose 50 to 70% of their excess body weight. In losing that excess body weight, it helps resolve their health issues such as hypertension, diabetes, sleep apnea, and even their joint problems. Often patients with renal failure get better, and even patients who need kidney transplants with weight loss can get on the transplant list and end up getting their kidney transplant. A lot of patients are very hesitant to undergo surgery or any type of surgical procedure to lose weight. Most patients feel like they don't need it, that they can do it on their own. And many patients have lost hundreds of pounds only to gain it back. And the first step is the patient realizing that they can't do it on their own. A lot of patients try and can, but there's a majority of patients who can't and need some type of help, a tool to help them lose that weight. And that's what surgery is. And once a patient realizes that and comes to that conclusion and makes that decision for themselves, they're able to proceed with the surgery and do very well with it and lose the weight and maintain that weight loss.